Hello, everyone. My name is Diogo Fortes, and I am a doctoral student at Johns Hopkins University, as well as an intern with the Maryland Center for Developmental Disabilities at Kennedy Krieger Institute. I am a Black man with Black curly hair, and I am wearing glasses and a green shirt. For the AIRP Research Day, I'm going to present on the Faith Community Learning Collaborative, which is an IDD-inclusive faith support ambassador program for faith leaders. While I am your presenter today, Dr. Miriam Fonadu, who is my supervisor at the center, designed and implemented this intervention, and none of this would be possible without her work. Faith communities play a key role in shaping an individual's environment, acting as important sources of social and moral support. However, individuals with intellectual and/or developmental disabilities and their families often feel excluded from faith-based spaces due to fear of judgment and stigma, but also due to a lack of sensory and behavioral accommodations. Services can be long and loud, with the expectation that people largely keep still and seated, which many autistic people, for example, can have difficulty with. As respected community agents, faith leaders can shape attitudes of their congregations and denounce discrimination. However, despite being motivated to create disability-inclusive religious spaces, many feel uncertain about how to go about it. To address this, our center worked to implement a collaborative learning and training initiative meant to give faith leaders the tools to promote intellectual and/or developmental disability inclusion in the faith communities that they lead. This initiative comes in a few different steps with measures collected at different times. We start with a pre-training survey, which asks faith leaders to 1, rate their respective faith community in terms of how inclusive it currently is, and 2, rate their own preparedness to implement inclusive practices. We then have a 2-day training conducted by Dr. Fonadu based on a curriculum she developed. And at the end of the training, we give them another survey asking about their preparedness, where we hope to see how much they've learned. 3 months after, we survey them again. And then participants that have gone through training can apply to receive $500 grants to be used to fund a small inclusion-promoting project in their communities. For our first cohort of participants, we recruited 13 leaders, and we present pre- and post-training survey results for the 12 that completed both time points. Of the 13, 10 led Christian denominations and 3 Jewish denominations. 10 of the participants led communities of at least 300 members, and all were from Maryland, with most coming from the Baltimore and DC metro areas. This stacked bar chart shows the responses for the questions about how inclusive you believe your faith community to be. On the left, you can see the question item, and then each part of the bar is a proportion of participants that endorsed a given option. The options were strongly disagree, disagree, not sure, agree, and strongly agree. No one endorsed strongly disagree for any item. From the responses, we see that most participants describe their community's mission statement and general attitude towards disability inclusion to be positive, but written policies, guidelines, and accommodations in terms of facilities and spaces are much more uncertain or even missing. This is an image description of the previous chart. Now, this horizontal bar chart compares the pre- and post-training survey responses to questions asking about preparedness to improve inclusion in faith spaces. Here, I want to highlight how the areas where we see the most impact of training is in assessing and implementing written policies and guidelines, as well as spaces and facilities, which are the 2 areas that our participants reported being weakest in their communities. This shows that our training curriculum is filling a recognized gap in the toolkits of faith leaders to promote inclusion within their spaces. This is an image description of the previous chart. Finally, we were asked to consider how we have translated our work into the community and what successes and failures we've had with that process. Since this is a community-based project, I'll try to answer both questions at the same time. Given the size of each of their faith communities, some in the hundreds or even about 2,000 members, having faith leaders who can self-assess and enact inclusive practices carries benefits to potentially innumerable people with intellectual and/or developmental disabilities. The collaborative aspect of this training is also meant to strengthen networks among leaders, where those who have been trained can disseminate practices and knowledge to those who haven't. While we do see impact on self-reported attitudes and preparedness, it's important to acknowledge we don't currently measure actual changes in guidelines, for example. For now, we have no systematic way of tracking if tangible changes are being made. However, as some leaders have chosen to participate in our mini grant funding program, we have some examples of the kinds of activities that faith communities can do at a small scale to welcome people with IDD. This is a cropped flyer for a Sensory Sunday event that one of our grant awardees put together, and which implemented several accommodations that allowed people that hadn't been in that congregation for a long time to be able to participate fully. Going forward, our biggest challenge is funding support to ensure that we can continue engaging with these communities, sustaining the trainings we offer, which are all free of charge, and making sure that we reach a more diverse slice of faith traditions and regions of the state. These are my references, and thank you so much for your time.